Good afternoon, everyone, and welcome to today's webinar, The State of State-Level Public Health Advocacy, brought to you by the Network for Public Health Law. I'm Daniel Wacker, and I'm the Program Development Associate here at the Network for Public Health Law, and I'll be your host for today's webinar. We strongly encourage audience participation by the Q&A function at the bottom of your screen, and we will have some chat response questions as well, but please use the Q&A function so that the speakers can see your questions for the end of the presentation. All you need to do is click on the button, you'll be able to enter your question. Your moderator for today's webinar is Attica Scott, who is the Director of Special Projects at Forward Justice Action Network and a former Kentucky State Representative. Attica is deeply rooted in building healthy and safe communities, and as the director of the special projects at Forward Justice Action Network, a 501c4 organization that serves as a strategic partner for coalitions, networks, and nonprofits at the forefront of movements organizing for a more equitable, free, and just U.S. South. Attica has worked as an action learning coach at the County Health Rankings and Roadmaps, a collaborative of the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute, where she advanced into an associate researcher of cultural of health prize review team lead and the University School of Medicine. Attica served for 3 terms from 2017 to 22 as a state representative, and in 22 was the only Democratic woman in Kentucky to run for the U.S. House of Representatives. In 2021, Today's Woman magazine voted Attica most admired woman in politics, and in 2019, the Kentucky Gazette featured her as one of the most notable women in Kentucky politics and government. You can follow Attica at Attica Scott KY on social media. Attica will be leading us through the rest of this presentation, so I'll hand it over to you. Attica?
Thank you so much, Daniel, for that kind introduction. I really appreciate you. And I'd like to take a moment to also do some introductions of our speaker. So I'd like to introduce our audience to Martha Katz, who is the Senior Advisor for the Network for Public Health Law's Fighting for Public Health Initiative. And it was my honor to share the stage with Martha back in October in Minneapolis at the Network's conference. I'd also like to introduce you to Quang Dang, who is a lecturer in the Department of Public Health, Cal State East Bay, and 50 State Scan consultant. And then finally, Leslie Zellers is a public health and public policy attorney with Act for Public Health. And you'll hear from all 3 of them in just a moment, and they'll probably be able to expand more on their bios. As the Director of Special Projects at Forward Justice Action Network, which is a 501c4 advocacy organization, and as a former elected official, I know that advocacy makes a difference for public health. I also know that institutions and systems often try to instill fear in the hearts and minds of public health folks to steer away from advocacy. But I'll tell you, if you steer away too far, though, public health becomes in jeopardy. And I'm sure that you have seen that yourselves in recent years. And we know from the political especially the politicalization of public health crises, including COVID and racism, that your advocacy is desperately needed. Whether it's a meeting with your elected official during a lobby day or over tea, you never know what conversations are helping to shift a policy maker. And when my neighbors and I were on the front lines of police accountability and racial justice in 2020, one of our young leaders kept reminding us to keep going. So you must keep going, even when a bad bill seems poised for inevitable passage. You must keep going. You never know what conversation you can have that can shift a heart or a mindset. So let's get started with our conversation, because y'all can probably tell that I am passionate about advocacy and public policy. So I want to make sure that you be sure to put your questions for our speakers in the Q&A area. It can be difficult sometimes to track questions in the chat, and you'll be able to tell that in a moment because there's going to be some dynamic movement happening in the chat. So I want to start with introducing our first speaker. And so reintroducing our first speaker, which is Martha Katz. And Martha, we'd love for you to talk to us about why we are here today and what difference state level advocacy makes to public health. So welcome, Martha.
Why is the hardest part remembering to unmute ourselves? There we go. It's a pleasure to be here today. As Attica said, I've had the pleasure of working with folks in public health for quite some time. And in the most recent incarnation, I also have the privilege and pleasure of working in private philanthropy. And I feel like those two fields come together when we talk about advocacy for public health. From my point of view, it's worth our time this morning being able to take a look at background of what we've been doing on strengthening advocacy for public health. We frequently use the term advocacy for public health, but we've gravitated toward talking about advocacy for the public's health. When we began these discussions in 2021, my colleagues Jean Matthews and Maddie Fry and I really had some good conversations with people around the country. Some people argued that the focus at the time should be on strengthening advocacy for public health agencies. Others argued that the focus should be on particular public health issues. We settled on the term advocacy for the public's health because it encompasses both. The mission we know of public health agencies is to protect and promote the health of people in their communities. And so we need to be able to do both, advocate for the people in our agencies, those public health workers, but also be able to advocate for better health in our communities. If we turn the clock back to 3 years ago, many state legislatures were enacting laws and bills that were truly a reaction to the COVID-19 pandemic and the impact on their communities. And both Q and Leslie Zellers, Q Dong and Leslie Zellers, are going to talk to that in more detail, but you know what they did. Many of the state legislatures passed laws that limited public health authority. They decided to prohibit schools and businesses from requiring masks and vaccines. In many communities, they limited the ability of public health officials to declare a public health emergency and shifted those roles from public servants to elected officials. At the time, a lot of us were asking, where's the voice of public health leaders, of other community leaders? Who's speaking up for public health in our state capitals? Where's the advocacy for the policies and legal strategies that protect health? As my colleagues at the Network for Public Health Law call it, those are the bright spots. Who's advocating for them? If you look at this first slide, you'll see the 3 efforts that have been sponsored by the Network for Public Health Law. First, in 2022, we did a feasibility study where we interviewed 90 leaders in both public health advocacy and advocates from other fields to be able to identify the 6 opportunities for strengthening advocacy for the public's health. And then if you look at that middle report, it reflects a convening that we held last April, where we brought together 50 leaders in Atlanta to look at the 6 opportunities in the first report and really help us define the priority actions that we need to get moving forward and to get moving forward quickly. And the third is the focus for today's webinar, the 50 state scan of public health advocacy. Now, as you can imagine, looking at all 50 states was no easy task, but we got lucky. A team of talented public health and legal experts, Hugh Dong, Manel Capagoda, Emma Waugh, and Leslie Zellers stepped up, and they did the scan, they designed it, and they did it remarkably quickly in the field. Hugh and Leslie are both here today to be able to share the great insights we heard from people in the field. If you haven't had a chance to look at these 3 reports, they're on the network's website, and I think somebody popped up the links in the chat while I was talking. But be sure to really have your fingers ready because we've designed this webinar today so all of you can add to the insights that we've heard from the state scan. Now, I promise context, so let's step back from the process for a minute and remind ourselves why we're committed to strengthening advocacy for the public's health. Next slide, please. Oops. Well, I don't know where the other slide went, but I'll find it. First of all, policy solutions work, and they generally have the greatest benefit for the greatest number of people in the least amount of time at the least cost. There's lots of evidence in my 40-year career in public health and in public policy that policy strategies in combination with the actions of individuals and communities lead to tremendous improvements in health across different ages, in different communities, and in different racial and ethnic groups. This is the month that is, I cannot believe this, but it is the 60th anniversary of the 1964 Surgeon General's report on smoking and health. So I'm going to spend a minute on tobacco control. Now, in my library behind me, I don't have the 1964 report, but I found the 1979 Surgeon General's report. And you can see from its great heft of over 1,000 pages why it was nicknamed the Great Blue Whale. Since the publication of that 1979 report, the percent of adults in the US who smoke has dropped from over 40% to 11.5% in 2021. That's a huge decline that led to equal declines in heart disease and cancer deaths. And we know that much of that is due to the mix of policy interventions, from clean indoor air laws to local smoking bans and ordinances to increasing the age for buying cigarettes. The current debate about banning menthol flavored tobacco products reminds us of the challenges in assuring that health benefits of public health policies are equally shared by everyone. It's extremely distressing, to put it politely, to see the efforts by the tobacco industry to divide and conquer the African American leadership community. They're pitting civil rights leaders against health leaders and community leaders against each other. But it's also equally encouraging to see the strong advocacy for eliminating menthol flavored products led by the African American Tobacco Control Leadership Council and fully supported by the Campaign for Tobacco-Free Kids, as well as what I call the Big Three, the three advocacy organizations for health: the Heart Association, the Lung Association, and the Cancer Society. They are speaking up and they are helping our community leaders speak up. Let's pull up the next slide. These tireless advocates remind us of the second reason that we're so engaged in building advocacy for the public's health. That's because sustained investments in advocacy make a difference. I'm in Georgia today, and Georgia is a big state with a very diverse population. We've got blue cities in Savannah, Atlanta, and Decatur, and a very red state legislature. It's one of the 10 states that haven't expanded Medicaid coverage to low-income families. About 20 years ago, I had the privilege of being part of Georgia's philanthropic community that came together to address the noticeable weaknesses in Georgia's infrastructure for advocacy on behalf of Georgia's children. Yes, in many public health policies, we do children first. And this was especially true as the philanthropic community looked at education, health, and child welfare in Georgia. These different philanthropies came together to support the creation of the Georgia Budget and Policy Institute, who provides the data for everyone. They supported the creation of Georgians for a Healthy Future that advocates and brings consumer voices in on health policies. And they created Voices for Georgia's Children that looks at children's issues across the board. I have a quote today from Polly McKinney, who's the advocate for Voices for Georgia's Children. Georgia has a state legislature that meets for 40 days and 40 nights every year. And so she sent out this notice saying, bills are a dropping, admins are a hopping until March 28th, sine die, nobody's a stopping. In Georgia, the investments by these groups and advocacy organizations have made a huge difference. Last year, Georgia's advocates succeeded in getting the state to increase salaries for public health department workers. We were able to provide a full year of Medicaid coverage for pregnant women. And the state legislature passed a comprehensive mental health parity act. Have we been successful in advocating for Medicaid expansion? The advocates would say, not yet. But this year, after years of resistance, the Republicans in the legislature are starting to talk about Medicaid expansion in exchange for looser certificate of need requirements for healthcare facilities. Now, I could not make this up. There's a headline in the Atlanta paper that says, Speaker of the House uses the words Medicaid and expansion in the same sentence. That was newsworthy. The savviest advocates will be striving to help them move Medicaid expansion forward while also making sure that whatever happens provides real healthcare coverage for low income Georgians, because strong advocates never quit. Many of you in this webinar represent the backbone of the work needed for effective advocacy. You know your cities and communities. You know your strengths and you know your challenges. And we're hoping that by coming together, you will help us learn to work with people outside of our comfortable circles, because we all live in both red and blue communities. We need to learn to communicate with people who have different values and perspectives. We need your help in designing the policy solutions that reach people most impacted by health inequities. And together, we need to figure out how to create sustainable ways to fund advocacy. We're delighted you're all here today. I'm looking at the numbers. We're up to 375 people, which is so darn cool. And we can't wait to share with you the results of the state scan. But most of all, we want to hear your ideas about how we move forward. Thank you so much for coming.
Wow, thank you so much, Martha. I appreciate you. And I have to say, I'm in Kentucky, so I can certainly appreciate the menthol cigarettes example that you shared. And thank you for reminding us that advocacy and prevention are similar, and that with both, we may not be able to see that work in action, but it's happening. So again, thank you. So hey, folks, we'd like y'all to start sharing with us in the chat a little bit more. We'd like to know what you want to hear more of today during this webinar, and we have a poll for you. So the poll question is, do you think public health advocacy leaders in your state will be more engaged in defense or offense in the upcoming legislative session? So you got to choose one, defense or offense, and we'll give you about a minute to respond. And hopefully you see the poll question on your screen and you can participate there as well. Right, thank you so much. Oh, hopefully you can see the results. It's an interesting split between defense and offense. So you'll probably have some questions for our speakers as we continue on with the webinar. So I want to take a moment to bring on Maddie, the amazing Maddie, who hasn't been introduced yet, but is managing the Q&A. So Maddie, please introduce yourself, and then if you could share if there have been any questions in the Q&A yet before we move on to the chats.
Sure, and there have not been any questions in the Q&A, but this is a great opportunity for me to point that out to folks. The Q&A icon on the bottom of your screen is the place to ask questions. So please do click on that and put any questions that you might have in there, and we'll be monitoring that throughout the webinar. So we do really want to hear from you. What is it that you're hoping to hear about today, and what questions do you have as we go along?
Thank you so much, Maddie. Appreciate you so much. So we have a chat question for y'all. This is so someone asked what were the actual poll results. They didn't see them on the screen. I'll see if Maddie can put them in the chat for y'all. So our first question we'd like y'all to respond to in the chat, and if you can see the poll results there on your screen. Defense was 56%, offense 44%. All right. So if you can see on your screen, the first chat question we'd like you to respond to in the chat is, what is the most politically divisive public health issue in your state? So this is the most politically divisive public health issue in your state. And we'll give you about a minute to respond to this question in the chat. Lots of similarities across states. Lots of similarities. I mean, these are opportunities for y'all to build across states with one another and connect. Wow. Thank y'all so much for participating. Lots of important issues. All right, we're beginning to slow down. All right, I think we can go to chat question number 2.
Can I jump in for a
Sure,
second?
Q, please.
I just wanted to first of all introduce myself. Hi everyone, I'm Q, and you'll be hearing from me in a little bit about the 50-state scan and then the report. But I'm quickly trying to train my eyes to read this blur of answers that are going by. And I just wanted to say that things that I'm seeing, some of the patterns I'm seeing are things that we talked with people about during our 50-state scan, things related to essential public health services. When we ask a question about public health advocacy, we hear about all of these very broad public health issues, but also very specific issues: transgender care, abortion, reproductive freedom. All of these issues were issues that came up, and I think speak to just how broad many of the issues that advocates are working on and are passionate about and are fighting for in the different states, how important they are. I think that I appreciate Martha very much, Martha mentioning how there are so many different values that we see, and we also see this common spirit of fighting for public health, whether it be across broad public health issues or very specific issues that are very, very divisive, and the care that people are taking in order to approach these issues. So I just wanted to throw that out there, and maybe we can. These are now I think we're seeing coming in are the chat answers to question number 2: what public health issues in your state enjoys the most bipartisan support? And this is also something that we were really interested in terms of starting to build coalitions, understanding that values are different in different places, but there are also a lot of shared values, even across the country as well as within a state. Martha talked about how there are blue population centers within a state that might be have red areas outside of that. So really looking for issues that can bring together bipartisan support, and Medicaid expansion was something we heard, especially for new mothers, was a big issue that we heard about in many different states that were trying to find an issue to, play a little bit of offense with and not just be playing defense in their legislative season.
Wow, Q, thank you so much for sharing your reflections on people's responses to the chat questions. You're helping to connect folks in the chat. And so to help do a little bit more of that connecting, we would love to remind folks to please put your name in the chat, the organization that you're with, your location, because I'm sure that there are folks who are looking at your responses and thinking, oh, I'd like to connect with this person about their response to this question and see how we may be able to build regionally, for example. So please be sure to put your name and your organization and your location in the chat. And we'll give you just a few more minutes to do that. And then we want to definitely bring Q back to continue sharing with us. So y'all can keep putting your contact information, name, location in the chat. And then Maddie, I see that you've come off mute. Did you want to chime in?
Yes, we are getting a couple great questions in the Q&A. Please keep them coming. The 2 questions that are in there so far, we actually will be addressing later in the webinar. So don't worry that we're not addressing them right now. We'll get to you later on.
Maddie, can you lift up those 2 questions just so we know what they are?
Definitely. So one question is, how do we build an intentional strategy to engage GOP members in public health? Great question, Katie Adamson. And then from Eric Coles, how do you balance focusing on politically divisive issues versus those that may have larger impact on overall health, especially considering differences in issues on equity versus impact on general health outcomes? Great, thank you.
Yeah, thanks, Maddie. Those are going to be important for Leslie and Q to think about as we continue forward. So thank you all again for participating with the poll and the 2 chat questions, and for making sure to share your name and location and organization in the chat. So I want to turn it back over to Q for this conversation to share with us findings and opportunities from the 50-state scan. So again, welcome back, Q, and I turn it over to you.
Thank you, Attica, and thank you everyone who's been participating already so much with the chats. We are going to be using all that information that goes into the chat, not just for informing our conversation today, but we'll be following up with that also. So I'm here to talk to you about the report that is available by on the network site, the State of State Level Public Health Advocacy. This was built on the work our team did, and I wanted to give a big shout out and thank you to the key informants, the respondents that we talked to in every state who shared their time, their expertise. They came from many different areas, which I'll talk about in a moment. But they really provided us with so much information and insights into, as you can see, a very complicated and broad question that we were looking at. I also wanted to thank our funders, the CDC Foundation and de Beaumont, as well as our amazing project advisors who kept this project on track, Martha, Maddie, who you've met, as well as Jean Matthews and Don Hunter, who gave us guidance as we moved along this pretty speedy approach to looking at what is going on in the different states. All right, next slide, please. So from March to June of last year, we interviewed public health advocacy leaders in each state and Washington, D.C. And we didn't have a steadfast rule as to who this person had to be. This person could have been state and local health department representatives, members of large associations that had advocacy and lobbying experience in the state. It could be elected, appointed officials, lobbyists, partners in other sectors and organizations, recognizing that the larger public health system is not just the public health department. It could be a organization in a state that's fighting for transgender rights. That could be a perspective that we need to look at in order to understand advocacy for public health in that state and in other places. We were really aiming for getting different perspectives over consistency of results in terms of comparability and seeing what we could, what one state had in terms of resources and assets. This isn't the sort of study where we can now say, well, this state has more of this than more of that. We're just looking at different perspectives from different places and using the richness of the different states as a way to search and investigate. Next slide, please. So the report is broken up into 6 broad areas of findings and corresponding related opportunities. And I'll just quickly read through this slide just to set the context for where we're going with this presentation, and then take each one of these in more detail. So finding number 1 was that public health's role and value is often misunderstood, and this could be for a number of different reasons, which we'll talk about. And the opportunity that's there is for organizations, for funders, to work on elevating public health's value proposition, trying to help the public, trying to help opponents as well as proponents understand how to deliver the message of what it is that public health does and the value of public health. I'm smiling a little bit because I have the chat box up and I'm seeing names of people popping up that we talked to on this, for this report. Public health is often reluctant to rely on lobbying and advocacy. The folks that we talked to were experts in advocacy and lobbying, and they talked to us about how much of their work is about talking with other people who are hesitant to really do the strongest amount of advocacy and lobbying that they are legally allowed to do. And the opportunity that's here, that's highlighted in the report, is encouraging strategic advocacy as well as lobbying and calling out that lobbying as well. 3 challenges to public health authority make advocacy more difficult as well as more essential. And these are the attacks on public health that Martha talked about, and Leslie will talk about more also. We saw them before the COVID pandemic. We've seen them heightened and exacerbated during the pandemic. And the opportunity here is to counter these challenges to public health authority, and we'll have some more detail with that. Number 4 is a really important finding here, one that we put front and center in our conversations, and one that I can honestly say was consistently a core value of every single person that we talk to in every single state. Health equity is fundamental, and it requires nuanced communication. The communication is different from place to place around health equity, but the singular mission and guiding principle of health equity as being something that is at the core of public health and at the work of the organizations and people that we talk to, whether it is someone who is working broadly on lobbying for public health authority, or someone who's working on a specific issue, the fight for health equity is an important opportunity. Public health allies remain untapped resources. We talked to so many different people who relied on the coalitions and allies in public health across the broad public health system, and talked about the importance of coordination and tapping into strengths and support of allies that might be outside of public health, might be slightly tangential to public health, including healthcare. And number 6, the public health workforce is underfunded, and looking at ways to support the public health workforce coming out of the pandemic, coming out of the ebbs and flows of funding that has come with the pandemic and the pandemic responses as well. Next slide, please. All right, so I noticed a question about being able to differentiate between the different uses of the term public health. And this is something that we try to address when we're talking about the definition of public health. In the report, the definition of advocacy that we use is encompassing a broad range of activities, including research, public education, lobbying, and voter education that can influence public policy. So really just using the word advocacy to look specifically at public policy, as well as understanding that it could mean education, research, lobbying, as well as other influences as well. I'm gonna just throw that out there, and then if we can advance to the next slide and go back to to our poll questions. I want to just get everyone back in to looking at these different components. Daniel, can I have the next slide? Great. So our next poll question here which component of the definition of advocacy do you think is most important to strengthening public health? Research, education, or lobbying? Set that on for a few more seconds, and then if possible, I'll take a quick look at the results. Education and lobbying are slightly higher, 55% for education, 42% for lobbying, 5% for research. And then if we can move on to poll question number 3, which is very similar. It's the same choices, but which would you like the most assistance or support with within your work? A few more moments here before we close this out. Right, so for this third poll question, some of the assistance or support that's needed has been redistributed, perhaps from education to research, and lobbying is the area that moves or surfaces as the area that requires the most assistance or support within our work and within the work of public health, moves up to 56% compared to 33% and 12%. Thank you so much. Let's move on to the next slide, please. All right, so one of the chat box comment I saw about the confusion sometimes around even talking about what public health is something that we came across early on in this scan when we talked with different folks. And we started off a lot of our conversations with the question, well, what do you define as public health advocacy? And that simple term, public health advocacy, is not a simple term as it turns out. Public health can be a profession, it can be a field of work, it could be a broad system of different organizations and associations. It could be a concept. It can also, as it turns out, be a target for folks that don't support government work. We realized very quickly that different definitions might be needed for different uses. We realized that equity language was very important and needs to be tailored. There are some places we talk to where just saying health equity isn't enough. You have to spell out specifically the evidence-based health research on racial and ethnic health equity. And other places, the word equity was something that advocates did not feel like they could use. We also wanted to recognize that in defining public health advocacy, we needed to talk about all the different tools that advocacy entails. So we talked about education, we talked about research, we talked about advocacy, but lobbying does have a very special role in this, and it is not only something that we see as the participants in the study talked about as being important, but also something that people need a lot of support around. We also wanted to talk about public health advocacy in terms of community partners. So not just public health, state and local health departments, but also the community partners that are mobilizing individuals and groups. Such a key part of advocacy and lobbying as well as talking through the specific issues that are coming up, the specific issues that are important to communities and important to organizations. As we saw in the chat box, so many different issues that people out there related to public health are working on, and those issues need a place also. I do have the working definition that we were using, and this is one that we also recognize needs to be tailored for different uses, needs to be made simpler if possible in some places, and might need different ways of talking about it in different communities and in different jurisdictions. Next slide, please. All right, so let's move to our first finding. Our first finding is that public health has the expertise and tools to help all communities achieve health and well-being, but the role and the value of public health are often hidden and or misunderstood. Next slide, please. So we talked to many folks who talked about how difficult it is to communicate the scope of public health, as well as its successes, its subdisciplines, as well as how to talk about the data that it relies on or what the data is asking the public or organizations to do. This is at a baseline, a difficulty that public health has in terms of communicating what its mission is and what its purpose is in a way that the public fully understands. In terms of on top of that, in the particular moment that we're in and coming out of, public health is also reacting and existing within the context of disinformation campaigns and misinformation campaigns that have been spearheaded by opponents of public health. Now, we know that a lot of this was occurring before the COVID pandemic. We know that we were having many battles with disinformation and misinformation around the Affordable Care Act, around healthcare access. And yet the COVID epidemic with mask mandates and with vaccines created new opportunities for disinformation campaigns to be spread. There's also, we also had discussions with people about mistrust from Black, Indigenous, and other people of color communities that might exist from prior and existing harms created by public health, health, as well as others that are related to public health. And one of the findings that I think is important was that specific health issues may be more relatable in many different states, even states that have strong public health support. Specific health issues may be more relatable to the public and to legislatures than broad ideas of public health. One of the Q&A questions that came up was about how to make intentional conversation, how to have intentional communications with GOP lawmakers. And one of the findings in the report was something that came up over and over in our interviews with respondents, was that it's extremely important to make the case to more conservative decision makers and to tailor those conversations around workforce issues, economy, prosperity, return on an investment, rural health. I think some of the other folks, some of the other issues that were mentioned in the chat box that were discussed by people around the country were mental health as also an issue that people wanted to talk about: behavioral health, mental health, as well as the opioid epidemic. One finding that came up that was of note and that is called out in the report is the successes of the Indiana Commission on Public Health in a Republican-led state with a Republican governor that has brought public health as a not only as a standing a standing value that is considered during the legislative process, but also legislation being passed that has led to a 1,500% increase in state funding for local health departments based on a matching program that is proposed under this ruling or under this law. And this makes it much more possible, I think, in other states for something like that to happen. Next slide, please. The report, it has some great quotes for us from the speakers themselves, from the respondents themselves. And the one that I really want to highlight here is that public health bills have to be workforce bills, not public health bills. So it's just a way of reimagining what laws might look like if you want to get the attention of more conservative lawmakers. Next slide. The second finding was about advocacy and lobbying specifically, and that members of the public health workforce and state local public health leaders are often reluctant to rely on tools such as advocacy and lobbying that have served other sectors well. Next slide. This is one of those findings that wasn't a surprise by any means, but it was I think important to hear across all the different states how crucial lobbying is for success, how it is not well understood by all parts of the public health workforce, and that many in the public health workforce are constrained from doing stronger advocacy or lobbying, or think that they are constrained from doing so. And this might be for very real laws that are in place, or it might be because of fear that has been placed on them by the actions of different folks in their states. We also talked a lot about the variable legislative cycles from state to state and how this makes lobbying even more complicated and something that requires work of direct lobbyists, maybe from outside public health, and overall the need for more training, resources, and clarity. Next slide, please. These quotes about lobbying, I think, are illustrative of the value of lobbying. The public health workforce underestimates and undervalues how much it can actually advocate. The public health organizations are the subject matter specialists, but the paid lobbyists have the relationships, make the calls, and get things through. Public health cares about how policy looks and affects people. Lobbyists care about winning. Both are important. Next slide, please. All right, the third finding of the report is public health measures in response to COVID have sparked ongoing challenges to public health authority, making advocacy even more difficult and essential. And with this finding, I'm excited to be able to turn the presentation over to Leslie Zeller. Can you bring us to the next slide, Daniel? Leslie will be talking about some of the work from Act for Public Health, as well as how we are able to move forward with the attacks on public health that we're seeing around the country.
Thanks, Q. Next slide, Daniel. So I'm really happy to be here today. Should have done all my coughing before I went off mute. Happy to be here today with all of you to talk a little bit more about the results of the scan and Act for Public Health, which is a collaborative of different health law partners. It's 5 organizations, including the Network for Public Health Law, which is sponsoring this webinar, Change Lab Solutions, Temple University, Public Health Law Watch, and the Public Health Law Center in Minnesota. And as Martha alluded to in her opening remarks, this initiative was really born out of the response to public health measures in the COVID pandemic. Starting in 2021, we started to see a real backlash to some of the public health requirements for masking, for vaccines, for social distancing, and a very well-coordinated effort to counter some of those laws. Next slide. So Act for Public Health is funded by the Robert Wood Johnson Foundation, and some of the things that we do, and you can reach out to us for assistance on or tracking some of these bills and laws that are introduced and passed, as well as the court decisions, some of the court cases challenging public health authority. And if you have a question about a specific bill or would like technical assistance on an issue in your state, we're happy to answer that. We have a really great website, which I'll put the link up to. We have events that we do, publications that are coming out, trainings. And so I encourage you to get on. We have a really good listserv. We do not spam you. It's lots of cool stuff that comes out, no more than once a week. And if you could go to the next slide. Initially, it was a primarily defensive effort. So it was interesting to see the poll results in terms of whether your state is looking primarily at defense or offense. So there were bills introduced in literally every single state in 2021, early 2022 to prohibit public health authority to enact some of these measures to protect people against COVID-19, or as Martha also said, reallocate that authority, to take the authority away from the public health officials, the public health professionals, to elected officials. If you look at the next slide, we saw in the chat, one of the most common issues that you are dealing with, I think abortion probably had more votes if I counted them, but I did see vaccine issues coming up from a lot of you. And so this is more recent data. You can see how many states have bills introduced. This was 2023, prohibiting vaccination requirements for school entry, or expanding non-medical exemptions, or switching control for vaccine requirements to other agencies other than public health. So this is a very live issue. And this is something that takes a lot of time and a lot of effort for everyone in these states that has a color on it other than white to try to counter these bills. If you go to the next slide. But we don't only want to be in a defensive mode, because we're not really going to accomplish what we'd like to do if we're only trying to put out fires. So the next phase of what we're trying to do in collaboration with state and local public health officials is to create a positive agenda for public health. So if we don't want our authority taken away, or if we don't want limits on certain things that public health can do, what do we want to do? And what is that public health authority used for? We don't just want public health authority for the sake of authority. It will not always be used in an equitable way. So how can we make sure that we're doing things that are protecting the public's health? Next slide. So one of the first ways we looked at that is the Network for Public Health Law created a report looking at examples. So they started scanning some of the bills and laws that we saw introduced to see what are some good examples, and came up with this report on innovative laws and policies for a post-pandemic public health system. If you go to the next slide. So these laws are categorized into what we affectionately refer to as the honeycomb, these different areas of bright spots of public health, whether it's governance or health equity or workforce. Q already gave one of the examples that is highlighted in the report. The Indiana Public Health Commission is an example. There are other examples that are in this report that talk about how people in different states are approaching these issues differently. For example, Oregon and Washington both had strong efforts to strengthen their public health infrastructure, but they did it in very different ways. So if you go to the next slide. So in addition to, yeah, this is my next slide. So one of the things that was very satisfying is we looked at what are other organizations doing to see what's going on for the future of public health. So many of you are familiar with APHA, has the Alliance for Disease Prevention and Response, and they did a crosswalk of, there are a bunch of reports out there saying what's the future of public health. And they came up with this list of key themes. And you can see there's a lot of overlap here in the honeycomb: financing and funding, workforce, governance. So that was reassuring and satisfying to see that we're kind of on the right track in terms of themes. Next slide. So really, since we are organizations that are focused on public health law, we wanted to look at the question from a legal perspective. What are the laws and policies and structures that we need to serve the public health equitably and effectively? So for example, how can public health respond nimbly to public health emergencies, the next COVID pandemic, whatever that's going to be? How can public health provide public health services on a day-to-day basis, providing immunizations, providing blood lead testing, things that public health does day in and day out? And then how can we also look at upstream activities that improve public health? Next slide. So in addition to collecting examples of positive public health law, we're also trying to create a framework, a set of shared values and measures. What should the law be? Q has talked a bit about health equity. He'll touch on that a little bit more after I finish. So what are our shared values? How can public health laws be equitable? And we aren't looking so much at creating a model law, for example, on Medicaid expansion or access to family planning services, but more a set of values about what should the law enable us to do? How can we have this authority? I will not confess to be up to date on the chat. I'm doing my best, but I saw a really interesting comment from the state of Michigan about how they had a recent court case overruling the authority of a state health department to enact certain emergency measures. So that's the kind of thing that we're looking at. How can we ensure that the state health department or the local health department or health agencies have the authority they need to enact the measures that will protect public health? Next slide. So we are collecting examples. You guys have put tons of fantastic stuff in the chat. We are going to save this and comb through it. We also have this Google form if you want to give an example of something that's working well in your state, an example of good public health authority. We'd love to hear your examples. You can scan this QR code or fill in the form. And then the next slide. Here's the website for Act for Public Health. Like I said, join our email list if you're not already on here, connect with partners, learn about different events, and we would love to be a resource to you. So I'm going to pass it over to Q to dive more into the report. Thanks.
I knew that would happen. All right. Thank you, Leslie. I'm going to, for the sake of time and make sure we get a chance to get to these questions, kind of keep my transitions brief and really focus in on finding number 4, health equity. This was such an important part of the conversations that we had, and we heard over and over that health equity is fundamental to public health. And then we also heard that it requires nuanced communications in some areas. Next slide, please. I will we have 2 poll questions. Let me do this one and then we'll skip the next one. But if you were training a voter to talk to a lawmaker in your state legislature about a public health issues, would you suggest that they use the term health equity, especially as it relates to race and ethnicity? Please feel free to expand on your yes/no answer if that seems too limiting in the chat box. So I'll keep the poll open for a few more moments, and then we'll move on. And if you want to talk about some of the reasonings behind your yes or no answer in the chat box, please do so. All right. So I'm gonna looks like it's 43 to 51%. All right. So I'm gonna move on to 2 slides down the line. Great. So let's talk about the poll results. So it was 49% yes, 51% no. And as you can see in the webinar chat, there are so many different reasons for using or not using the term health equity. I think we all know how important it is, and that's something that we heard over and over from the people that we talked to. It's so hard to deny the facts about racial disparities, and I don't think anyone that we talked to wanted to do that. But the question is how to figure out a way to discuss health equity without making the conversation stop. One of the quotes I want to highlight here, we're a long way off from talking about health equity. In most communities, we're still just introducing the concept. Community health centers in the state and the fight for Medicaid expansion, and I think specifically this was Medicaid expansion for new mothers, all overlap with health equity, but buzzwords and splashy DEI terms are not used. Next slide, please. So some of the things I wanted to highlight as in the conversations with the respondents about health equity. Health equity was repeatedly stated as a crucial work of public health. We talked about the importance of offices of health equity and declarations of racism as public health crises in different states. We talked about the resistance to using the term, how it's somehow it has even been removed from official usage in some states. And on the other hand, we also talked to a handful of states that have equity analysis explicitly built into the legislative review process. So any bill, any bill that's considered in some states don't need just an environmental impact analysis, but also an equity analysis. So we see this broad spectrum of the way we communicate around health equity, which again has been politicized. We talked about using terms in some states, not even being able to use the term social determinants of health, which is such a building block of what public health workforce learns about as part of their mission. Some states, we learned that they use the term non-medical factors. If they say social determinants of health, it's seen as a signal to turn off listening to what that person's message is. We talked about communicating around fairness or access, and also highlighting specific issues that allow lawmakers of different political backgrounds to make laws that promote health equity, regardless of the communication around it. And so some of those issues, one of those bright issues that came up over and over was talking about rural health and how important that is, and how there are also so many allies there that can be tapped into. The one bullet point that I really want to call out here also is the importance of talking about tribal health. We talked in several of the states with advocates and leaders who talked about the importance of the history of having to advocate for their own existence and their own survival, and how that has become such an important part of the work that they do, how it presents certain models that might be useful for other people looking to work and advance health equity, how the work in one state with tribal councils helps inform the public health framework there, how working in tribal health may actually be more bipartisan than other issues, specific issues or populations that are worked with in public health. This is an area that we see as being critical as we move forward and needing further work to bring together. Next slide, please. All right, so I'm going to quickly just read through the next two findings and then talk about the opportunities that are highlighted in the report so that we can get to questions. The fifth finding of the report, many public health allies at the local and state levels remain untapped resources for protecting and promoting the public's health, including supporting public health advocacy and lobbying efforts. Next slide. The examples that was brought up for this finding is that states, many states, I would say more so than otherwise, wanted support for coordinating resources rather than creating new resources, and understanding that there is advocacy and lobbying happening, and the wheel doesn't need to be reinvented in many places. But just coordinating resources would be helpful. Others wanted new organizations and a better understanding of the role of 501c4s. There was a call for sharing advocacy models and lessons learned, and ways to respond more quickly to threats, as well as how to nurture more coalitions across all the great work that people are doing. Next slide. Finding number 6, the public health workforce stepped up to protect all of us during COVID, despite not being at full strength going into the pandemic and being severely tested during the pandemic. COVID-related funding infusions are helpful, but not sufficient unless sustained. And next slide, please. One of the examples that, many different examples were brought up, but one of the examples that is called out in the report is that among state health officers, only 4 pre-COVID leaders remained in place across all 50 states. And just a highlight of the decades of expertise and knowledge that may not be passed on as continuously as possible. Next slide. All right, so I'm going to finish up here with a few slides on the opportunities to respond. I will go through these pretty quickly, and I just want to call out that these are all in the report. They are listed by the 6 findings and opportunities areas. In the report, it's not just these opportunities to respond that you'll see here, but there are also key opportunities. There will also be specific opportunities for funders, which is useful if you're a funder or if you're looking to talk to funders, as well as other ideas that propped up. So this is not all that's in the report, but this is in the report. So finding number 1, or opportunity number 1, elevating public health's value proposition. Folks talk about how to create a consistent message to highlight public health's contributions, customizing public health messages to local state contexts, addressing misinformation and disinformation, and creating affinity groups for advocates in red states, talking about how to have a playbook to talk to conservative lawmakers. And I see this as a theme as well as a question in the Q&As and in the chats. 2, encourage the strategic deployment of advocacy and lobbying on behalf of the public's health, building capacity and motivation to deploy a full range of advocacy tools, including lobbying, including advocacy skills and core competencies, curricula, and professional development, as well as bolstering and expanding lobbying capacity. Next slide. 3, countering challenges to public health authority. The call to actions, the QR code, and the other resources that Leslie highlighted are all important work from Act for Public Health and its member organizations as ways of understanding the scope of challenges, as well as sharing your success stories, enlisting allies to counter challenges, and track legislative and litigation attacks on public health, which many of those member organizations do such an amazing job of. Fighting for health equity with or without the language of health equity, sharing multiple ways to express the concept of health equity, developing and testing how to make a strong case for health equity in different political environments, as well as sharing successful examples of fighting for health equity. Next slide. Tap the strengths, capabilities, and shared interests of supportive allies. This is opportunity number 5, strengthening ties to allies with the ability to lobby on shared goals, including in other areas such as voting rights, climate justice, etc. And another area that we heard a lot about was that rural health organizations. Support collaboration among existing organizations and funding new advocacy and lobbying organizations where needed. And finally, supporting the public health workforce, document and advocate for what full-strength public health would look like, rebuilding public health infrastructure with sustained investments, and supplementing government funding by actively seeking out funders that will support the public health workforce. So that's it for my overview and review of the state level advocacy report. I will turn it back to our moderators to open it up for conversation.
Thank you so much, Q. And audience, I imagine you're like me. You're like, oh, okay, I can't wait for these slides to come out because you want to track and follow everything that Q and Leslie have shared. So I want to thank Leslie for talking to us about why we advocate, especially considering the audience responses to 2 of the poll questions that Q shared, and also questions that were posed directly in the Q&A. And then, of course, thank you, Q, for the important grounding on the state level advocacy. And shout out to our audience. I see y'all using the chat to connect across regions and sectors, share more about your work, and share resources. This is definitely the definition of a network, and I'd love to see it. So doing a quick time check, we've got about 18 more minutes in this webinar, so we want to get to your questions. So Maddie has shared a couple of questions with me from the Q&A, and then after our speakers respond to these questions, Maddie, I'll check with you to see if we have additional questions. So our first question for Leslie and for Q, and really, Martha, if you want to chime in as well, is how do you discover the fine line between working at a local health department, but being able to advocate for public health services within your position? So again, how do you discover the fine line between working at a local health department, but being able to advocate for public health services within your position? And this person gave an example. They said tabling in the community to help register to vote without it being lobbying or political. So anyone is welcome to take that question.
Martha, do you want to go and then I'll jump in?
I'm going to go first, and I'm going to bounce it back to Attica as a former future elected official. When we interviewed people for our original feasibility study, an elected official told us that she'd been in the state legislature for 25 years and had never been visited by her local health officials. And Ms. Scott, would you tell us what you'd like to be hearing from people who are in public health?
Definitely, Martha, and then I'll turn it back over to Q. So when we had our panel discussion at the National Network for Public Health Laws Conference in Minneapolis in October, one of the things I shared is, as a state representative for 6 years, I don't recall public health officials coming to me to talk about an issue. I had plenty of lobbyists who did that, well-paid, well-dressed lobbyists who did that, but not the public health officials. The only time I engaged with public health officials is when I had a question, something that I needed to understand or wanted to get some resources or information from them. So I encourage y'all, please engage with your state elected officials because they need to hear from you just as much as they're hearing from the people with the money who are in their faces all of the time. And so I want to go ahead and turn it over to Q to respond.
Thank you so much. So we heard over and over from folks who said that they had to spend their own time doing things like that. They had to spend their own, create separate email addresses, different time to do political work that they needed to, things that they couldn't do while they were working. Even so, there were times when people felt like even if they were allowed to separate out their different roles and what they were working on as something that they're interested in, they were afraid for their jobs. We talked with folks who said that the Surgeon General in their state was very vocal about being anti-vaccine, and so they were really afraid about speaking up about anything related to public health outside of their work. So it is a really difficult area to be involved with. And I think what I heard from folks was to learn about what was legal and allowable for you to do, trying to separate it out so you're not using local health department resources in order to do the work that you are hoping to do. And then know that there are other people who are figuring out this balance and this line. There are several trainings that are done by the member organizations of Act for Public Health, including Change Lab Solutions, that have the trainings on what is allowable in terms of lobbying if you work for a 501c3 versus a health department versus a 501c4. So it's important to know what's right, but also recognize that there are very real, fears and threats that are thrown around, even if you're doing something that's allowable.
Thank you for that, Q. And I would also add that one of the things that concerned me when I was a state representative is I represent people. So as your representative, I would have liked to have sat down with tea. We could have some hot tea. I don't drink coffee, but we could have had hot tea as your representative and you as my constituent for me to just learn more about the work that you do, not necessarily you trying to lobby me to vote yes or no on any particular piece of legislation, but you sharing and saying, this is what we do at the health department in our community, and we would like you to know more about that. So, that's something else I think that it's important for people to think about and consider is engaging in those conversations mean that now I'm more educated and aware about the work that you do, but you haven't asked me to vote any particular way on an issue. So I just wanted to share that with you. And I want to check in, Leslie, to see if you had anything you wanted to share as well in response to that question.
I will just add, I think this is a transition to another question that Eric Gorovitz, who's go Eric in the chat, thank you very much, pointed out that this is a real opportunity for government employees to work with their partners who do not have the same restrictions. And depending on your job and your political environment, you have more or less flexibility to be very open in how you're doing that. But I think working with the C3s and C4s who can do some of the lobbying is going to be important, including your local APHA affiliate, which is, I think, one of the other questions that came up.
Yes, thank you for that, Leslie. So we have one more question for y'all from the audience, and that question is very similar to the one you just answered, but adds to it. And that question is, public health advocacy can be structurally challenging for those that are in government agencies. How have you all seen public health professionals best engage in advocacy without letting their limitations, political and otherwise, in administrative agencies stop them from doing so? Again, how have you all seen public health professionals best engage in advocacy without letting their limitations in administrative agencies stop them from doing so? Who would like to respond?
So I think what we've been talking about is there are things that you can do as a government official that are education. And I guess we're trying to encourage people to work both within their agencies and with their partners on doing the very permissible education. And then, part of what we've been doing all this work about for the last couple of years is how to strengthen the nonprofit community to be able to do the real lobbying. So there's a little bit of a role for lots of different players, and there's some great conversation in the chat. I'm kind of distracted by it because it's so good, of how you can do that and how you bring in people like the Heart Association or the YMCA or all those partners who you work with on your programs also have the ability to help amplify your voice. But then there's also some skills for people in the governmental jobs. And I did it for a long time. It's hard, but figuring out how you can do some of that education as part of your official job is also quite useful. And then it's synergistic. It empowers your nonprofit community to be even more vocal.
Yeah, thanks, Martha. I'll respond to that and I'll echo Martha's response and actually Leslie's response to the previous questions. I think this is an area where it's so important to remember that when we're talking about public health, we're not just talking about the health departments, we're talking about this larger public health system, which includes all of these different partners, whether it be organizations or the member associations that do have more advocacy and lobbying capacity and experience, as well as higher education. I think that I think there's a question in the Q&A about higher education, and there are some states that it's hard to tell. Higher education is not just bringing in the evidence base, but is working on the research, the advocacy to their allowable extent, and then working with other people. And somewhere along this tapestry, we are finding that people are directly engaging with lobbyists also. And the lobbyists have such an important role to play. We talked to so many people in so many different places that talked about the importance of having the lobbyists have the relationships with people in the legislatures, and how a public health person, someone from a health department, might not have those same relationships. We talked a little bit about the variability of legislative cycles. There's one state that we talked to has a 180-day legislative season, but it's only once every 2 years. So you could go for a year and a half without having offices for those legislatures. So I'm not sure where someone who's not a professional lobbyist would even know where to go to visit the lawmakers. Wouldn't have a physical space. So that's where we look at kind of weaving together the different roles for different people. And there are times when government officials can do advocacy, research, education on their own time. There's education, research, there is testimony that they can provide in an official capacity. And there are times they have to work with partners and form coalitions or get into funding agreements or relationships where someone else is doing the work that they're not allowed legally to do, or that they don't want to give the improper, give any kind of improper ideas about what they're doing too.
Thank you so much for that, Q. Go ahead, Martha.
There's some questions in the chat about the role of public health associations. In the work we did, we learned that 12 of the public health associations actually have paid lobbyists. So there are in some states where the the public health associations themselves are very active in the advocacy for the public's health. In others, it's reflecting some of the concerns people are talking about for governmental employees. So it's, it's like everything in this wonderfully rich, diverse country we have. There's a lot of variation. And that's part of the reason for looking at this state by state, is to be able to tease out some of the examples of what works in a very relatively blue state, and also trying to figure out some of the strategies that work in more conservative areas. A couple of people mentioned rural health as one of those grounds that can create some common ground, and that's true in a lot of parts of the country.
Thank you so much, Martha, for that. And as we know, one size doesn't fit all, right? So every place is going to be different. There are going to be lessons learned. I'll also say that while I was speaking specifically of public health, medical professionals lobby us often. So make friends with your medical professionals as well, because they can share your story as they're going to lobby. So thanks y'all for digging into those questions. There were a lot more questions, and some of them can be found, answers to some of those can be found in the report. So folks, please make sure that you grab that report. And so as we close, I want to make sure to turn over the mic to our speakers for closing comments. I know we've got about 4 minutes left, so their comments will have to be about a minute each. But I want to start with you, Q, and then go to Leslie and then Martha. It's like a rapid response.
Okay. All right. So one thing I learned from when the report was in the drafting process was that the word advocate comes from Latin, and it means to add a voice. And one thing we heard over and over, and we're seeing on this webinar also, is the importance of adding that voice. And one thing that maybe doesn't come out as much in the report as I would like, and I would throw out there, is the importance of new voices in public health. Many of the things that we're talking about building coalitions, lifting up equity, addressing, making it more understood to the public, I think could be addressed if we were willing as public health to look at new voices that are coming up, even if it's not necessarily saying all the things that we're used to hearing. It might be on a novel new health issue that we're not used to talking about. So that's what I would plug in my final minute.
And what I want to lift up, I put in the chat some resources on communicating about the value of public health, because there were some questions about this. How do we let people know what public health is doing, and how do we do that without lobbying? There are a number of organizations that have really good resources on this. The networks Becoming Better Messengers, De Beaumont has phrases, Berkeley Media Studies Group did a report specifically on framing around this issue. American Heart Association has something about conservative decision makers. So there's really good stuff in there that does not involve lobbying or advocacy, that you can just help people understand the value of public health, which can give them a baseline for these more nuanced conversations.
And we're closing with you, Martha.
Thank you, everyone. I'm stunned that most of you are still here. I've been popping an eye at the numbers. It's pretty amazing that you came, you stayed, and you contributed. I personally have about 7 windows open on my computer to follow up on some of the resources that you guys popped up. This is the start, the middle, the beginning of what I hope is a continuing great conversation and the hard work of building advocacy for the public's health. So thank you all for all you do, and keep those great ideas coming, and keep doing all the good work you're doing on the ground.
All right, y'all. Thank you so much to our speakers. Please show them some love in the chat. And here's what I learned from listening to all of you, that there is work happening to strengthen public health advocacy in every state, and there are plenty of opportunities for you to get involved in your state. So thank you to our amazing audience for your vibrant participation, and please look for an evaluation in your inbox after the webinar, and stay healthy and safe. And that's it for me. Bye, y'all.
I'm actually going to pop in and say a quick word just to let everyone know that every attendee will be receiving a recording of the webinar as well as the materials in about a week. after this webinar ends, so be on the lookout for that. You should be receiving an email in your inbox with all that. So once again, thank you to our speakers and to Attica for hosting a great webinar, and we'll see you all next time. Thank you all.
Bye, thank you.